Thank you for coming here and being with us today. We have CME on liver diseases from 2nd, 3rd and 4th, and I think some of you were here a couple of days ago, right? So when we had the transplant anesthesia workshop. As an ongoing program and as our ongoing commitment to teaching, because medicine cannot progress unless people teach, and I think one of the responsibilities that all healthcare organizations have is not only in treating patients but also teaching everybody else who would benefit from the knowledge that we have. And in this context, we will be organizing the CME, and I'm going to have asked Vivek to introduce you to what is the program for the next 3 days, and so that they can do. So Vivek and Conclave will field all your questions as well, and Dr. Rela is there to answer.
So this CME is, as probably the handout says, it's probably the first of the kind in India. Why it is unique is, there are a lot of conferences happening all over India as far as liver is concerned the last couple of years, but this is the only one where 3 or 4 specialities concerned with the liver are combined together. Pathology is one of the most main subjects related to liver diseases, and this concept is basically from King's College Hospital, or in most of the colleges, hospitals in UK, where all the surgeons, the pathologists, the radiologists sit together and discuss the histopathological aspects of the liver diseases, which a surgeon or a medical doctor should know, because that's how it helps in treating the medical and the surgical diseases. So the whole concept is the brainchild of Professor Rela, and he thought that we should do this conference here in Chennai, which would benefit all the liver surgeons and the liver medical doctors, what we call the hepatologists in India. So we've been planning this for the last 4 to 6 months now. We've got big international faculty, over 25 doctors from all over the world are joining us, and we have all the eminent top-notch doctors from India joining us as speakers and chairpersons. As of now, the total delegate registration has crossed 350 for this meeting. We have surgeons, we have liver medical doctors, we have pathologists, we have postgraduates from all over the country joining us for the meeting. People. So we only hope that everyone joins us and get benefited out of this meeting. And of course, one of the main person behind this meeting is also Professor Bernard Boatman, who's from King's College Hospital, and whom we probably will come to the venue tomorrow. You'll be able to meet him. He's, we could say, the father of liver pathology, and he's been in King's College Hospital for over 30 years. So he's got a vast experience in liver pathology, and every pathologist around the world look him as the godfather of liver pathology.
40 years.
40 years, is it?
He's been doing liver pathology for 40 years. And he discovered things that people didn't discover here. This is over 25, 30 years ago. He was the one who first made a major publication on what is the reasons for Indian childhood cirrhosis. So we really have somebody big. You want to say something?
Interestingly, as we started inviting people for this conference, the interest evoked was so surprising. It started from students to practitioners to really well-established gastroenterologists. Everybody had an interest in this because it's like taking them back to the teaching days and telling them all what's happening now.
The idea is very basic here. Those things happen all the time. I've been in India now for 2 years. I've attended several conferences. The idea is get important people from the rest of the world or get important people from this country, and everybody comes, they're given a 20-minute time, they give a talk and they go. Half of the people who are in the audience are half of the people who are giving a talk, It becomes so monotonous that you go to conference after conference, you have the same topic being discussed. What I decided is to replicate how I learned liver disease. pathology, liver disease, and how I learned about liver disease. And the best way to learn about liver disease is actually have practically how patients are being managed. So, one subject. For example, let's say fatty liver. It's very common in our country. Half of you here will have a fatty liver, okay? Maybe even me. So an authority will give a talk on fatty liver and then will summarize and says what are the implications of fatty liver. And then I'm going to put a series of patients with fatty liver and how they're being managed. The spectrum of it, fatty liver with cancer, fatty liver, a donor with a fatty liver wanting to donate, a donor who's donated with a fatty liver and we've used the liver. So the learning is actually not textbook.
So this is not really patient.
The best experience you can get out of any teaching is by real cases, and you learn over many years. You may learn everything in the textbook until you actually, and there are certain diseases that you only see 3 times a year or 4 times a year in the experience center. And if you want to see 4 cases, you have to work in an experience center for a whole year to see the 4 cases. But we've got cases accumulated over the last 20 years, the best sort of cases, which are going to be presented and people are going to practically see how things are going to manage. And they're going to just share their actual clinical experiences.
All over the world.
The success rate for liver transplantation for a straightforward patient coming from home who's in a stable condition is 90% only. Whereas the success rate once the patient is in hospital and sick, it reduces to 80%. And the success rate for somebody who's in a ventilator and who requires dialysis, who's comatose, can be lower, 75%. So the success rate depends on how severe the liver disease is at the time of transplant.
நாங்கள் அடுத்த 2 நாளைக்கு வந்து மாஸ்டர் கிளாஸ் இன் லிவர் டிசீசஸ் அப்படிங்கிற கான்ஃபரன்ஸ் ஒன்று கண்டக்ட் பண்ணுறோம். இது வந்து மெயின்லி லிவர் சம்மந்தப்பட்ட கான்ஃபரன்ஸாக இருக்கும். லிவர் அண்ட் பெத்தாலஜி சம்மந்தப்பட்ட கான்ஃபரன்ஸு. இதில் வந்து ஒரு 30க்கும் மேற்பட்ட டாக்டர்ஸ் வெளியூர்லேருந்து ஃபேக்கல்ட்டியாக வராங்க இங்கே டீச் பண்ணுறதுக்கு. வெளிநாட்டிலேருந்து இந்தியாவிலேருந்து வந்து ஒரு 300-350 பேர் வந்து இதில் வந்து பயன்படுறவங்க நாங்கள் நம்புகிறோம். இது வந்து யாராருக்குன்னா வந்து லிவர் டிரான்ஸ்பிளான்ட் சர்ஜன்ஸு, லிவர் மெடிக்கல் டாக்டர்ஸ், ஹெப்பட்டாலஜிஸ்ட்டு, குழந்தைங்க டாக்டர்ஸ், பீடியாட்ரிஷியன்ஸ், பெத்தாலஜிஸ்ட் அண்ட் நிறைய ஸ்டூடெண்ட்ஸ் வராங்க. எல்லோரும் இதில் பயன்படுவாங்க நாங்கள் நினைக்கிறோம். இந்த ஃபார்மேட் வந்து கம் ஃப்ரம் கிங்ஸ் காலேஜ் ஹாஸ்பிட்டல். ப்ரொஃபஸர் ரேலா தான் வந்து அங்கே அவர் எப்படி லிவர் டிசீஸ் கற்றுக்கிட்டாரு அதேமாரி இங்கே எல்லோரும் கற்றுக் கொடுக்கணும் அப்படிங்கிற எண்ணம் வந்து என்கிட்ட சொன்னார். நாங்கள் வந்து ஒரு 6 months அதில் ஒர்க் பண்ணி இப்போ வந்து இந்த கான்ஃபரன்ஸ் நாளைக்கு நடக்கிறதுக்கு நாங்கள் இது மூலமாக நிறைய பேர் பெனிஃபிட் ஆவாங்கன்னு நாங்கள் நம்புகிறோம்.